Introduction. Epistaxis, commonly referred to as nosebleed, is a condition characterized by bleeding from the nose. It is a relatively common medical concern that affects people of all ages and can range from mild to severe. Understanding the various aspects of epistaxis, including its causes, clinical presentation, diagnostic evaluation, and management options, is essential for healthcare professionals who regularly encounter patients with this condition. Epistaxis, or nosebleed, is a common medical condition that occurs due to the rupture of blood vessels within the nasal cavity. It can be categorized into two types: anterior epistaxis, which originates from the front part of the nasal septum, and posterior epistaxis, which originates from the back part of the nasal cavity. Epistaxis is defined as the spontaneous bleeding from the nose, which may occur due to various underlying factors. It can be classified into two main categories based on the site of bleeding: anterior epistaxis and posterior epistaxis. Anterior epistaxis is more common and usually arises from the Keys-Selbach's plexus, an area rich in blood vessels located in the anterior part of the nasal septum. On the other hand, posterior epistaxis originates from the posterior nasal cavity, where larger blood vessels, such as the sphenopalatine artery, are located. Epistaxis is a prevalent condition, with studies reporting varying incidence rates globally. The exact prevalence is difficult to determine due to the variability in reporting and the mild nature of some cases that may not require medical attention. However, it is estimated that approximately 60% of the population will experience at least one episode of epistaxis during their lifetime. The occurrence of epistaxis is slightly higher in children and older adults, with a peak incidence during the winter months. The nasal cavity is a complex structure that contains a rich network of blood vessels. The anterior part of the nasal septum houses the Keys-Selbach's plexus, which consists of an anastomosis between several arteries, including the anterior ethmoidal artery, the superior labial artery, and the greater palatine artery. In posterior epistaxis, bleeding often originates from the region known as Woodruff's area, which contains the sphenopalatine artery and its branches. Numerous factors can contribute to the development of epistaxis. Common causes include trauma to the nose, dryness of the nasal mucosa, nasal infections, hypertension, coagulation disorders, and certain medications like anticoagulants and nonsteroidal anti-inflammatory drugs, NSAIDs. Environmental factors, such as low humidity and exposure to irritants, can also predispose individuals to epistaxis. The pathophysiology of epistaxis involves the disruption of the nasal vasculature due to various factors. Local trauma, inflammation, or drying of the nasal mucosa can lead to the rupture of blood vessels within the nose. To maintain hemostasis, the body employs several mechanisms. The primary hemostasis involves vasoconstriction and platelet aggregation, while the secondary hemostasis entails the activation of clotting factors to form a stable clot. Epistaxis can present with a wide range of symptoms, ranging from mild to severe, depending on the underlying cause and extent of bleeding. Common clinical features include sudden onset of bleeding from one or both nostrils, blood dripping down the throat, coughing up or vomiting blood, and a feeling of pressure or fullness in the nose. In severe cases, excessive blood loss can lead to dizziness, lightheadedness, and even fainting. To diagnose the underlying cause of epistaxis and rule out other potential conditions, a thorough evaluation is necessary. This includes taking a detailed medical history, performing a physical examination, and ordering specific diagnostic tests. Differential diagnoses may include nasal tumors, coagulation disorders, nasal polyps, and, rarely, systemic diseases such as Wegener's granulomatosis. Upon presentation with epistaxis, a systematic approach to triage and initial assessment is crucial. The severity of bleeding and the presence of any associated symptoms should be evaluated. Proper immediate management, such as direct pressure application and patient positioning, should be initiated to control bleeding and stabilize the patient's condition. In many cases, conservative management techniques can effectively treat epistaxis. These techniques include pinching the soft part of the nose, ice pack application, and keeping the head elevated. Additionally, maintaining nasal moisture through saline sprays or nasal emollients can help prevent further nasal drying and minimize the risk of recurrent bleeding. For more severe or refractory cases of epistaxis, nasal packing may be necessary. Anterior nasal packing involves placing a tampon or dressing in the front part of the nasal cavity to apply direct pressure to the bleeding site. In posterior epistaxis, posterior nasal packing, usually with an inflatable balloon, is employed to reach the bleeding source further in the nasal cavity. To aid in the control of bleeding and reduce vascularity, various topical and systemic vasoconstrictive agents can be utilized. These agents include topical application of silver nitrate, adrenaline-soaked pledgets, or tranexamic acid. Systemic medications, such as oral antifibrinolytic agents or intravenous vasopressin, may also be considered in specific cases. In conclusion, epistaxis is a prevalent condition with bleeding from the nose. Anterior and posterior types exist with various causes. Healthcare professionals should understand its anatomy, pathophysiology, and management options to effectively treat it. Conservative techniques, nasal packing, and vasoconstrictive agents are effective approaches.